In the last 3.5 decades of designing medical technologies, we've often found inspiration for innovative design by observing people in extreme situations. We've researched healthcare across Europe, we've visited China's interior, we've interviewed the busiest surgeons in America. Recently, our research team dove into emergency medicine to look at the provision of care in that dramatic environment. What we found was that the Level 1 trauma system is incredibly capable at delivering rapid, coordinated, protocol-driven care that saves lives. So we engaged our design team and brought in Dr. Kruger, a healthcare improvement fellow, to see if we could apply some key principles of emergency medicine to broader healthcare in order to reduce unnecessary hospital visits and improve the healthcare experience for all patients.
Before I became a doctor, I was a bone marrow donor. And during that experience, I developed a relationship with a patient and his family that convinced me that I needed to be in a profession where I would take care of patients, but also develop long-lasting relationships with them. Ethnographic research helps us strip away the biases that are created by the care environments that we're currently seeing patients within. That's huge.
This is just part of our immersive deep dive in order to really understand what is this like, not just from a patient perspective, but also from the physician and the providers that are caring for these people.
Over the course of a few weeks, we shadowed Dr. Mary Beth Johnson on busy nights in the emergency department at UCSD.
You're not going to die right now. We're going to get an EKG. I think you feel a little spooked out right now because you're having that bad pain and you had way too many Red Bulls, okay?
Trauma care is by necessity rapid. There have been innovations in process, technology, and training that have turned individual clinicians into well-coordinated teams that save lives when seconds count. From the moment you contact 911, a whole team of first responders spring into action. A mobile ICU nurse helps coordinate the movements of emergency responders to whichever hospital is closest, has the capabilities and has the capacity to treat that patient. She relays information from the field to the specialists and readies teams and facilities to intervene as soon as the patient arrives. It's an amazing demonstration of care coordination.
What are his pupils like?
Pupils are coral at 4.
Perfect. I will let trauma know you guys are coming.
And protocols help manage crisis scenarios in a calm and controlled fashion.
They want the basics. They want the briefs of what's going to kill my patient right now. And if they don't get that, or if time is wasted by us delaying with unimportant information, then that could cost the patient their life.
I think we were sort of anticipating coming out of the experience saying how we could improve the ER. And in fact, when we left, it was more about, this is working quite well, and is there a bigger opportunity to take what we learn here and apply that in the interest of patient centricity over in this other domain? Now we're back, and we're spending the day together, visualizing our findings and just getting things out on the wall and talking together as a group to try to synthesize what we found, and from there, draw out some strategic insights.
And by the time the patient comes through the door, they already know all the basic statistics, which room the patient's going to be and who's going to be tending to that patient.
In general medicine, you rely on the patient to give you information.
I think if you're sick, your kid's sick, whatever, you just want to talk to someone.
In Canada, we have that 1-800 number, which is part of the healthcare system.
Last time I called a nurse line, I was in incredible pain. They made me spend 10-15 minutes telling them all this.
What if it's just an inexpensive kit that you can take those tests and it can upload it?
First aid kit.
It's the new emergency kit. So you open it up, there's a thermometer, take out the thermometer.
It's a 21st century first aid kit.
Yeah.
And you could use that as an enabling technology to interface with your nursing service.
Wow, that would be perfect.
Today in medicine, we deliver care where we feel like it's appropriate. In a hospital, in a clinic, in the back of an ambulance. But in the future, we're going to be delivering care with patients where they might feel it's appropriate.
How are you feeling now?
It's all technology-based, but this human interaction is still very important.
I think what design really does is it starts to spark that side of us that's creative, that's interested in ingenuity, constantly challenging ourselves to think about what adds value to this patient.
Good evening, Mrs. Hillstead. May I please have the last 4 digits of your social security number?
2139.
Thank you. I see you're calling about Charlie. and he has a temperature of 103.
What other symptoms does he have?
Well, he says his stomach hurts. I'm worried about appendicitis or something. Do you think I should take him to the hospital?
We want to have a service that takes patients from defaulting to going to the highest level acuity and stratifies them into other areas of acuity and potentially allows them to never have to leave their home in the first place.
We have a camera, thermometer, blood pressure cuff,
EKG, pulse oximetry,
a little scope.
That's pretty cool. Patients are going to play a larger and larger role in their own care, but experience and relationship is still necessary. That's why people still need medical care and medical professionals. We're going to have to understand how we fit into their care that they want, desire, and need. I think healthcare can use design to help us gain a better perspective of the whole picture of what's going on.
She can pick up the phone and call the doc box and consult with someone who has either different or more experience than she has.
I'll continue to monitor Charlie until morning in case it does turn out to be something more severe.
Thank you.
We need to rediscover patients, and we need to find ways to reduce hospitalizations. Trying to find ways that we can help them be healthier is going to require a great degree of creativity.
This concept is just one example of a new care model. But we're at a moment in time in healthcare where we have the opportunity to rethink how we serve patients.